I think what we are seeing is that there's more and more molecular technologies which make us which help us to refine not only the diagnosis but actually more the prognosis, which help to stratify patients to treat them according to the right regimens. And we see evolution of technologies that help us to monitor these patients more closely, so to know how effective the treatments are. So I will especially focus in the workshop also on that, and MRD monitoring is improving because the technologies allow deeper and better and more accurate assessment of the actual residual level of cells. That is molecular methods, NGS based, but also flow cytometry has undergone improvements which lead to a more accurate and more deeper assessment of the residual level. So I think there's indeed a good chance that we can monitor patients deeper in that way. It's especially the deeper and more accurate assessments which we need, because many of the new therapeutic options allow to get deeper remissions. So we need to know at a deeper level what's really going on, whether it's deep enough in terms of the remission, or whether there's still residual cells that might earlier or later lead to relapses and the need for additional or sequential therapies.